Have you ever noticed just a small signal from your body? Maybe something feels a bit, it could be anything really, tiredness, an ache, maybe even something like, well, more intimate changing. We tend to ignore these things, don't we? Hope they just go away. But what if that little sign is actually like your body's check engine light, hinting at something bigger that, needs a look? Welcome to the Global Men's Wellness Podcast. Today, we're tackling a really important and honestly often unspoken part of men's health, erectile dysfunction. ED. And look, this isn't just about sex. It's a genuine medical condition. It affects your overall health, your mental state, how you age, your whole quality of life, really. So we'll break down what ED actually is, how it works biologically, look at the proven treatments we've had for ages, and then get into some really exciting new stuff, especially these intravenous therapies, changing urology care.
Yeah, it's interesting how ED often acts as this sort of signpost for overall health. When we talk about erectile dysfunction, the basic definition is, well, consistently not being able to get or keep an erection firm enough for sexual activity. It really is like that check engine light you mentioned. It tells us different body systems aren't quite working together smoothly. And a big misconception is that it's just, part of getting old. But that's really not the whole story. Things like diabetes, chronic stress, heart issues, they play massive roles, often bigger than people realize. And while, sure, mental health is a factor, it's definitely not just all in your head. It's a physical thing.
Okay, so if it's not just age, and it is physical, what's actually going on biologically? How does an erection even happen or, well, fail to happen?
Well, it's actually a pretty complex process. Think of it like a symphony orchestra. You need everything working just right for a good performance, So 3 key things. First, healthy blood vessels, good strong artery flow into the penis. Second, sharp nerve signals coordinating everything. And third, the right hormonal balance, especially testosterone. If any one of those instruments is out of tune, the whole thing can kind of falter. It's a delicate balance.
That symphony idea really helps visualize it. Okay, so understanding that, what treatments have we developed over time? Has it changed much? And how reliable are the solutions we have now?
Oh, absolutely. Treatments have evolved a lot over decades. This isn't some new experimental field. It's built on solid research. We have several established FDA-approved options. Most people know the oral pills, the PDE5 inhibitors. But beyond that, there are vacuum devices, penile injections, even surgical implants for tougher cases. And shockwave therapy is another proven one, gaining ground for improving blood flow. Now, you also hear about regenerative things like PRP, platelet-rich plasma. That shows promise, but honestly, it still needs more solid research before it's standard practice.
Right, so there are quite a few proven options out there, which makes you wonder, why do so many guys seem to think it's just the pills or nothing? Why isn't this more widely known?
Yeah, that's a huge issue. There are real barriers. The biggest one, probably stigma and embarrassment. Men just don't talk about sexual health easily. There are cultural taboos, too. And this feeds the myth that, pills are the only fix, or maybe there isn't any fix. So unfortunately, many men just stay silent.
Okay, so let's say a man decides, right, I need to sort this out, and he makes an appointment. What's that like? Is it going to be awkward or invasive?
That's a common worry, but modern care really tries to be supportive and, well, comfortable. A consultation usually means talking through your medical history. Pretty standard stuff. Then some simple blood tests to check hormone levels, maybe blood sugar, things like that. Sometimes we might do imaging, like a penile Doppler ultrasound, just to see the blood flow clearly. But the treatments themselves, generally painless, very discreet. Most aren't surgical at all. Surgery is really reserved for specific situations. The whole process aims to be reassuring, not intimidating.
That sounds much better than maybe some guys imagine. You mentioned personalized care earlier. How has that changed things? Is it less of a one-size-fits-all approach now?
Definitely. We've moved way beyond that. It's all about tailoring things now. That means specific diagnostics, maybe a full hormone panel, not just testosterone, and that Doppler ultrasound to really understand the vascular side. And crucially, we look at the whole picture. Lifestyle, diet, exercise, mental health. They're all part of the plan. It's treating the whole person, not just the symptom.
Okay, with all that tailoring, how well do these treatments actually work? Do we have good success rates?
The success rates are actually quite high for established treatments. Those PDE5 inhibitor pills, they help somewhere between 70 and 80% of men. Shockwave therapy, aiming to improve blood flow, shows positive results in studies for maybe 60 to 70% of suitable patients. And implants, for those who need them, have really high satisfaction, often up around 90%. The key takeaway, though, getting help early usually means better results. Don't wait.
90%, that's impressive. Okay, looking forward then, what's exciting on the horizon? You mentioned intravenous therapies earlier. Tell us about those.
Yeah, the future is really dynamic. We're seeing things like stem cell research moving forward, AI helping with diagnosis, telehealth making care easier to access, and more focus on prevention in younger men. But yes, these intravenous IV peptides and amino acids are a really interesting area for ED. What's exciting is that they often work in totally different ways than the standard pills, opening up new possibilities.
Different ways. Okay, let's start with one you mentioned, PT-141. How does that work?
Right, PT-141 or bremelanotide. This one's fascinating because it doesn't work on the blood vessels directly. It actually targets the brain. It activates pathways in the hypothalamus, a key area for sexual drive. So it's working on the central nervous system side of things. It was actually approved by the FDA back in 2019, but for women, for low sexual desire. Trials showed it helped with desire and reduced distress significantly. For men, animal studies looked good, showing increased erections, and human trials followed. One key trial looked at men who didn't respond well to sildenafil. Giving PT-141 subcutaneously, just under the skin, significantly increased how long their erections lasted. We're talking like 28 minutes average with one dose, 41 minutes with a higher dose, compared to just 6 minutes with placebo. And importantly, they didn't see issues with blood pressure or heart rate. Because it works centrally, it could be a really good option for men who take nitrate medications for heart conditions who absolutely cannot take the standard PDE5 pills. That's a big deal for that group.
Working on the brain, not the blood vessels.
Mm-hmm.
That is different and useful for those nitrate patients. Okay, what about the next one? PNPP19. Sounds unusual. I heard it comes from somewhere surprising.
Yes, it does. PNPP19 is a synthetic peptide, but it's derived from the venom of the Brazilian wandering spider.
Spider venom. Seriously.
But it's engineered to just mimic the beneficial parts, the bits that help with erections without any of the toxicity, obviously. Its mechanism involves boosting the nitric oxide pathway. Nitric oxide is key for relaxing the smooth muscles in the penis, which lets blood flow in. Preclinical studies, so mostly in animals, have shown it works well. It causes erections, increases levels of an important molecule called cGMP, and importantly, didn't seem toxic to major organs in those studies. It also seems to target the penis and testicles quite well when given IV or topically in these models. And like PT-141, it works independently of the PDE5 enzyme that the pills block. It might even work with sildenafil synergistically. But these are animal studies. We absolutely need human trials to see if it's safe and effective in people. And we need to know about fertility effects, too.
Okay, spider venom. Wow. So we have brain-acting peptides, spider-derived peptides. What about simpler things, like amino acids? We hear about L-arginine and L-citrulline for health all the time. How do they fit in, especially via IV?
Right. L-arginine and L-citrulline are fundamental players. They are the raw materials your body uses to make nitric oxide. And as we said, nitric oxide is crucial for relaxing blood vessels and getting blood flow for an erection. L-arginine is already in tons of over-the-counter ED supplements. Some studies, meta-analyses actually, show it helps in mild to moderate ED and it's generally safe. The problem with taking it orally, though, is absorption isn't great, and your liver breaks down a lot of it before it gets into your system. That's the first pass metabolism. This is where Al-IV comes in. Giving it intravenously completely bypasses the digestive system and the liver breakdown, so potentially much more of it gets to where it needs to work. Now, L-citrulline is interesting too. It gets absorbed better than L-arginine when taken orally, and your body converts it into L-arginine. Plus, it helps block an enzyme called arginase, which breaks down L-arginine, so it kind of boosts L-arginine levels in two ways. There was a small trial showing oral L-citrulline improved erection hardness in men with mild ED. Safe alternative for some. And studies do show that men with more severe ED often have lower levels of both these amino acids, so the potential with IV is clear. Deliver these crucial building blocks directly, overcoming the limitations of oral supplements, maybe even using both together.
That makes sense, getting around the body's breakdown processes. Are there already IV formulas with these amino acids that could work for ED? Or do we need new ones?
Well, most existing IV amino acid bags you see in hospitals are designed for nutrition, like for patients who can't eat. They often don't have much L-arginine or they lack L-citrulline entirely. They're just not optimized for ED. So ideally, for ED treatment, you'd want a specific IV solution, probably saline-based, no sugar, with a good mix of amino acids, but specifically higher amounts of L-arginine and L-citrulline. And of course, anyone considering this would need a proper evaluation, first medical history, blood tests for kidney function, liver function, electrolytes to make sure it's safe and to guide the dosing.
Sounds really promising, but I guess the big question is regulations. How close are we to actually seeing these IV options used widely for ED?
That's the reality check, yeah. Getting any new treatment, especially IV, through regulatory bodies like the FDA is a long, tough process, lots of rigorous testing needed. As we said, for PNPP19, there are no human trials yet. 0. For PT141 and the amino acids, the human studies done so far for ED have mostly used other routes under the skin, nasal spray, or just oral pills, not IV. So we desperately need large clinical trials, specifically looking at intravenous administration of these peptides and amino acids for ED. We need to prove safety, find the right dose, understand how the body handles them IV, check for side effects, all of it. Research might also look at combining IV therapy with pills, see if that helps. But, despite these hurdles, you see this boom in IV hydration clinics everywhere. People are clearly interested in IV wellness therapies, which might help push research forward.
Right, that IV trend is definitely noticeable. How do these IV ideas stack up against other newer ED treatments we hear about, like PRP or shockwave, in terms of evidence right now?
That's a fair comparison. Right now, things like PRP and shockwave therapy, LIESWTT, probably have a bit more clinical trial data and meta-analyses specifically looking at their use in ED. There are studies showing significant improvements with both, although research is still ongoing to optimize them too. So while IV peptides and amino acids are mechanistically really exciting and potentially offer unique benefits, they're currently at an earlier stage in terms of hard clinical evidence for ED compared to PRP or shockwave. More data is needed.
Okay, so it sounds like the future is heading towards having more tools in the toolbox, allowing for more personalized plans.
Exactly. That's the direction. A multimodal approach. Imagine combining maybe IV therapy with shockwave or with pills based precisely on what's causing that individual's ED. It's about integrating these innovations alongside established treatments to give men more options, better access, and truly tailored care, especially for guys who haven't had success with standard approaches.
This is clearly important work, really pushing things forward for men's health. Can I ask, just before we finish, what makes this work personally impactful for you?
It really comes down to seeing the change in people's lives. I remember one patient, he was really withdrawn. The ED wasn't just affecting intimacy, it had knocked his confidence, his whole energy for life. We found a personalized treatment plan that worked for him. And seeing him later, it wasn't just about the physical function coming back. He seemed like himself again, more connected with his partner, more confident. That reminder that this is about restoring connection, confidence, overall well-being, not just mechanics. That's what makes it incredibly rewarding. That's why we do it.
That really says it all. Thank you. And to everyone listening, if ED is something you're dealing with, please hear this. You're not broken. This is a medical condition, and there are effective treatments. The science keeps moving forward. We really encourage you to take that first step. Talk to a healthcare provider. Have those conversations, maybe with your partner too. And maybe just think about this. What opportunities for better health, for deeper connection, might you be missing out on by letting this conversation wait?